Hello, madam. Today I and Evelyn will be presenting about drepanocyte. So, drepanocytes are abnormally shaped red blood cells that take one on a curved sickle cell from due to a mutation in the hemoglobin gene. This shape change is primarily caused by hemoglobin (HbS) impairs the cell's flexibility and oxygen carrying ability. And the drepanocytes are the hallmark of sickle cell and anemies can lead to a serious complication like blood flow and tissue damage. So, what is drepanocyte? Drepanocyte is a sickle-shaped red blood cell named from drepano meaning the sickle, and this is caused by mutation in B globin gene to hemoglobin S, which is HbS. And this shape change occurs under low oxygen condition and rigid, sticky, and prone to blocking small vessels. This is seen in sickle cell anemia, which is we can see in a peripheral smear. So the science behind the shape of drepanocyte, which is a sickle cell, is because of caused by the mutation in the B globin gene to hemoglobin S, which is HbS, and HbS polymerizes under low oxygen condition. Polymerization distorts cell into rigid sickle shape, and these sickle cells lose flexibility and deform permanently and block small vessels and reduce oxygen delivery, and repeated cycles worsen the cell damage and symptoms. The disease related to drepanocytes are these can lead to chronic anemia, pain, and organ damage, and caused by inheritance of two sickle cell genes HBSS, most common in African, India, and Mediterranean population, and the autosomal recessive genetic disorder and carrier state sickle cell trait offers protection against malaria.
Drepanocytes presents with a range of acute and chronic symptoms that significantly impact patients' lives. For acute symptoms, swelling hands and feet are often the first sign in infants. Vaso-occlusive events which cause severe pain crisis, anemia leading to fatigue and weakness, and acute chest syndrome, which is a life-threatening complication marked by fever, cough, and chest pain. While for chronic symptoms, patients may have avascular necrosis, where bone tissue dies due to poor blood supply, stroke due to blocked blood flow to the brain, pulmonary hypertension and blindness resulting from long-term vascular damage, and lastly, organ damage from repeated oxygen deprivation. Next, we will talk about the laboratory methods used to diagnose drepanocytes, focusing on newborn screening and peripheral blood smear analysis. Newborn screening is critical for early detection. High-performance liquid chromatography or isoelectric focusing analyzes dried blood spot to identify abnormal hemoglobin types, which is SBS, sickle hemoglobin, HbF, fetal hemoglobin, and HbA adult hemoglobin. And this helps to confirm the sickle cell disease before symptom appears. While peripheral blood smear can be done by observing under a microscope, the first one will be sickle cell. These crescent-shaped red blood cells are pathogenomic for sickle cell disease. Howell-Jolly bodies. These nuclear remnants in red blood cells signal functional asplenia, indicating the spleen is no longer filtering damaged cells effectively. And other features has include target cell, nucleated red blood cell, and polychromasia, all reflecting the ongoing hemolysis and compensatory erythropoiesis. When having drepanocytes, the priority is to relieve the symptoms and prevent some complications. For the medications, pain relievers such as NSAIDs and opioids are used to treat severe pain during the crisis. Patients also have to stay hydrated, as dehydration can trigger the symptoms. In some severe cases, fluids may be necessary to restore the balance and reduce pain. Blood transfusion is to prevent stroke and treat anemia. They also dilute sickle hemoglobin with normal. Folic acid is a kind of B vitamin to support red blood cell production, helping to counteract the severe anemia caused by chronic hemolysis. Hydroxyurea is a therapy that boosts fetal hemoglobin levels, reducing the frequency of pain crises and acute chest syndrome. And lastly is bone marrow transplant. This is the only curative treatment for sickle cell disease. However, it is only reserved for patients with severe, life-threatening complications and must have a matched sibling donor. To prevent drepanocytes, genetic counseling and testing is crucial. Couples with a family history of sickle cell disease should undergo genetic testing before pregnancy. The early detection and intervention are possible with newborn screening. The next one will be avoiding triggers of sickle cell crisis. Patients should always stay hydrated, as dehydration can trigger sickling of red blood cells. Avoiding extreme temperatures, cold weather or excessive heat can worsen the symptoms. And lastly, avoid high altitudes, as low oxygen level can also trigger a pain crisis. Healthy lifestyle and medical cares are also important for drepanocytes patients. Patients have to do regular hematologist visits to monitor for complications and adjust treatment such as hydroxyurea. Taking folic acid supplements is also necessary to support red blood cell production to combat chronic anemia. For pain management, patients can take NSAIDs or prescribed pain relievers for crisis. And lastly, blood transfusion can be done in severe cases to prevent stroke or organ damage. In summary, prevention of sickle cell complication hinge on genetic planning, trigger avoidance, and consistent care. Together, awareness and action can be transform lives. Thank you.